pulse, place your fingers on the carotid artery located on the side of the neck to check for a pulse. Feel for at least 5 to 10 seconds. If there's no pulse, the person is in cardiac arrest, and you should start chest compressions immediately.
Welcome to Electrocuted CEWP. Today, we will discuss an incredibly important topic: how to perform CPR on an electrician who has been shocked or electrified with electricity. As electrical work involves handling live wires and high-voltage equipment, the risk of electrical shock is a real concern. When a person is shocked by electricity, it can cause severe injuries, including heart failure, respiratory issues, or burns. It's crucial to act quickly and know the correct procedures for performing CPR in such emergencies, especially if the person is unresponsive. Quick action can save a life. In this session, we'll cover how to recognize the signs of electrical shock, the necessary steps for ensuring safety, and the proper techniques for performing CPR. Understanding electrical shock. Before we dive into CPR techniques, let's briefly discuss what happens when an electrician or any person receives an electrical shock. What is electrical shock? Definition: electrical shock occurs when a person comes into contact with an electrical source. The shock can result from contact with high-voltage equipment, live wires, or faulty electrical devices. Effects on the body. Heart. Electricity can interfere with the heart's electrical system, causing arrhythmias or even cardiac arrest. The heart stops beating effectively. Respiratory system. Electrical shock may also affect the breathing muscles or the brain's control over breathing, causing respiratory failure. Other effects: burns, muscle spasms, and nerve damage are common, particularly at the point of contact with the electrical source. In some cases, a person who has received an electrical shock may become unconscious or stop breathing. This is where immediate action and CPR become critical. Immediate steps before performing CPR. It's important to ensure safety before you attempt to rescue someone who has been electrocuted. Here's what you need to do. Ensure the area is safe. Turn off the power. The first and most critical step is to turn off the power source. If you can safely do so, disconnect the electricity to avoid further harm. If you can't turn off the power, use a non-conductive object, such as a wooden stick or plastic broom, to move the person away from the electrical source. Do not touch the victim directly. If the person is still in contact with the live electrical source, do not touch them directly, as you could get electrocuted as well. Use an insulated object to separate them from the source. Call for help. Once the area is safe, call emergency services immediately. Let them know it's an electrical shock incident and give as much information as possible, including whether the person is breathing and their pulse.
Dear, I'm so grateful for your love and support. If you could subscribe and comment on my video, it would make my day. Check for responsiveness. Approach the victim cautiously. Tap their shoulder or give a gentle shake and shout to see if they respond. If there is no response and the person is unconscious, immediately move to the next step and begin CPR. CPR, cardiopulmonary resuscitation, is a life-saving technique used when someone's breathing or heartbeat has stopped. For an electrician who has been shocked, CPR may be needed due to cardiac arrest or difficulty breathing. Let's break down the steps to follow when performing CPR. Check for breathing and pulse. Check for breathing. Place your ear near the person's mouth and watch for chest movements. Listen for breathing sounds for at least 10 seconds. If the person is not breathing or only gasping, this is a sign that CPR is required. Check for pulse. Place your fingers on the carotid artery located on the side of the neck to check for a pulse. Feel for at least 5 to 10 seconds. If there's no pulse, the person is in cardiac arrest, and you should start chest compressions immediately. Chest compressions. Position the person. Place the victim on their back on a flat, firm surface. If necessary, move them to a safer area where you can provide proper CPR. Kneel down beside their chest. Start chest compressions. Place your hands in the center of the chest, just below the breastbone sternum. Place one hand on top of the other and lock your fingers. When performing CPR on an electrician who has been shocked, there are some important considerations to keep in mind. Be aware of possible burns. If the person has burns at the point of electrical contact, for example, on the hands or chest, do not apply ice or any creams. Simply cover the burns with a clean, dry cloth to prevent infection. Check for other injuries. Electrical shocks can sometimes cause muscle spasms or fractures. Be cautious when handling the person and avoid moving them unnecessarily unless they are in immediate danger, such as from a fire. Rescue breaths in smoky or confined spaces. If the person is in a confined space or if the shock occurred due to equipment malfunctioning in a smoky environment, ensure the area is safe before performing rescue breaths. If the air is contaminated, do not perform mouth-to-mouth. Instead, perform chest compressions only until help arrives. What to do after CPR? Once emergency services arrive or the person starts to breathe on their own, follow these steps, monitor the person. Keep the victim in the recovery position on their side with their head tilted back and mouth open to help keep the airway open. Do not let them walk or stand.
Get involved and share your thoughts. Comment below, then share this video with someone who needs to see it. What to do after CPR? Once emergency services arrive or the person starts to breathe on their own, follow these steps. Monitor the person. Keep the victim in the recovery position on their side, with their head tilted back and mouth open to help keep the airway open. Do not let them walk or stand. Give compressions by pressing down hard and fast at least 2 inches deep at a rate of 100 to 120 compressions per minute. After each compression, allow the chest to fully recoil, return to its normal position to allow the heart to fill with blood. Minimize interruptions. Continue chest compressions without pausing, as these are the most important part of CPR. Rescue breaths. Open the airway. After 30 compressions, open the airway by tilting the victim's head back and lifting the chin upward. This will help to open the windpipe. Give rescue breaths. Pinch the victim's nose shut and give to rescue breaths by breathing into their mouth. Make sure the chest rises with each breath, indicating that the air is entering the lungs. Each breath should last about 1 second, and you should ensure the victim's lungs inflate fully. Continue the cycle. Perform 30 chest compressions followed by 2 rescue breaths, and repeat this cycle until emergency help arrives or the person starts to breathe or show signs of recovery. How to perform CPR for a shocked electrician with special considerations. After a severe electric shock, the victim may be confused or disoriented. Do not allow them to stand up or move around unless they are under medical supervision. Provide information to the medical team. When the paramedics arrive, give them all the details about the incident, including the type of shock, duration of the shock, and any CPR performed. In conclusion, performing CPR on an electrician who has received an electrical shock can make the difference between life and death. Remember, the key steps are: ensure the area is safe and that the electricity is turned off. Check for responsiveness and breathing. If the person is unresponsive and not breathing, begin chest compressions and rescue breaths immediately. Continue the cycle of CPR until help arrives or the person regains consciousness. Quick and effective action in these emergencies can save lives, and knowing how to properly respond can be critical in any workplace, especially when working with electricity. Always remember to call for help and do your best to keep the victim as safe as possible. Comment below and share your thoughts. Then, share this video with someone who might enjoy it. Thank you for your attention and stay safe.